Welcome everybody. I can't believe, it's wonderful to get people all around the world. And I wanted to I'll tell you a little bit about my practice and then how I stumbled upon this table. I practice in Southern California in a coastal city in North County of San Diego, and it's very active. I'm really lucky that the beach is about a block and a half away. And I am a manual therapist. I'm a chiropractor, but I do a lot with soft tissue. And when I stumbled upon this, I was at the Parker seminar in Vegas, the big chiropractic convention, and I saw this table, and I couldn't believe what the provider was doing with it. And the gentleman happened to be a doctor in United Arab Emirates, Dr. Hassan, and he's on the Manuthera. He does a lot of their learning hub. It's a wonderful tool to use. But he was dancing with the table, and it made it look so effortless. And that was a huge appeal to me, because as a manual therapist, and if you want to do this for a long time, you need to take care of your body well. And that was the one thing I wanted to do really well, number one, and number two, get better patient outcomes. So as he was dancing through this, I did, and I would recommend this if you can do this. I wanted to experience it as a patient as well as experience it as a doctor. So I had that opportunity and actually talked with Dr. Hassan for quite some time. And it was, in between the classes, I would go back. I felt like I was stalking the expo over here at the table, because he did such a wonderful job, and I was learning little tricks. And that's why it was such a great tool. But that's my intro. I want to get, I'm thinking from your perspective, whether you're a chiropractor, a physical therapist, a doctor of osteopathy, a athletic trainer, a licensed massage therapist, anybody that's a body worker. This is a phenomenal tool to really up-level your game and take care of your body at the same time. So without further ado, and I know we have a PowerPoint. And PowerPoints are great to have information at the end of a seminar, webinar like this. But what I want to do is I really want to show you my 15-minute power routine that I do for patients. And I actually do this at the shows I've done a couple shows, and a lot of docs really appreciated this. So I can give people a great opportunity of what the table can do. But before I introduce you to my patient is actually more challenging, because he's a bigger gentleman, and he's a former athlete. But before I do that, and he's hiding in the corner over here, he's not hiding so well, but I want to show you a little bit of the table. I'll run through it quickly, then we'll go through that 15-minute routine. After that 15-minute routine, we're going to basically, there'll be a question and answer opportunity. If you guys or women, if you have any questions as we're going through this, Dwayne will be kind of the quarterback on the questioning, and I'd be happy to answer that after the fact. So let me show you some of just the capacity of the table, and then we can go from there. I think now you have, Dwayne really likes this. And by the way, it says my name. I'm actually a certified podorthist. I was for a long time, making custom orthotics. And I refer to myself as a dinosaur dad, because I have a 6-month at home and I'm 57. So I really need to take care of my body with this process, and this tool has helped me immensely. All right, let me show you the table first, and then we'll get into that routine. Okay, here we go. So I'll start with the headpiece here. And again, I'll go relatively quickly, because I want you to see the whole the routine, and really we can dive into that. So the cervical piece pivots like this. It goes down. It has 2 buttons, and it also has a traction knob on this side. The table, the driver's side is on the left side, because most people are right-handed. I'm just going to work my way down, and then we'll get our patient on the table. The arm pieces articulate. They come up. They articulate really well. There's a locking position at the bottom and a locking position at the top. And even this piece swivels as well. when you're working on shoulders and arms. Lower this way. The thoracic piece laterally flexes like this, as well as there's like a flexion distraction of at the lumbar region. There's one here at the CT region too, so we can do this as well. Moving my way down, lateral flexion of the lumbar spine. We have flexion distraction this way. We have translation, in this plane, and I usually lower it more when I'm doing this, but we also have the transverse plane, so we have rotation. These are all great options. We do have, for chiropractors that are all that do a lot with drop and want automation, this is not your table. We do have a drop piece here that's in line with, basically, it's in line with the SI joint and L5 as well. So that's what I use this for when I use the drop piece. Okay, let's do this. I'm going to talk about patient positioning. And what I want to talk about is the more challenging patient, and my wonderful patient George came here for me today to really go through this. And George is 6'5", and I asked him how much he weighed, and he said 254 today. So he's a former college baseball player, and he actually has a high degree of osteoarthritis in his hips. But I'm going to show you. I set this up this way because I have to accommodate his size. I'm actually tractioning out let's see this. I traction the lumbar, the lower piece out so we can accommodate his length. And what I'm also going to do is use the weight bar at the bottom. And this basically, I just will bring this down, and the bar stabilizes the table. It's really sturdy. I just do this as a precaution. And one other little trick that I have learned with George is, and he will tell you, I traction out the cervical piece, and I put a little cushion right here so it's more comfortable for him. And we learned that over time, okay? So without further ado, come on over here. Onto the table, yes, please. Thank you, George.
Sure.
All right, I'm just going to put you over a little bit this way. There we go. So the 15-minute routine, this is what I want to show you. I'll break it up. I'll have a little mini assessment, and then we'll do a treatment, okay? And usually when I place the patient down, the great part about this table, instead of having to work really hard maneuvering the patient, the table does it for me, and I have soft hands to kind of go into the area that I need to go into. A lot of patients love that. So I will start with the lumbar spine and basically the hips. I'm going to raise it up now. And when I raise it up, sometimes I forget this. I forget to take the bar off. So I'm going to put the bar away, because I'm going to be flexing and distracting this lower end too. Now, my assessment is, it's almost like a Hibbs test, but I'm going to see how much range of motion he has. I already know what he has, but sometimes they're going to compensate here, and I'll also even check, internal and external rotation. If you can back away a little bit. And I'll show you the other side. So he has very, very limited rotation internally. He has nothing internally and very little externally. So let me show you on this angle, Michael, so people can see. Even when I lift him up, his whole torso is moving over already. So it's a great diagnostic tool that I use. And then again, this is internal, and he's already compensating. Everything's moving over at once as I just gently pull his leg. Externally, I have a little bit of leeway. And this is what I will do. This is what I did in the past that bothered my wrist immensely. Was I would work the posterior glute just like this, but my wrist would be hyperflexed. So the smarter move for me was to basically do the same thing, but I'm going to start on this side. And now I'm able to do that with a relatively neutral wrist. And my process is I'm going to be leaning my body into this. My feet, my left foot, I'm using the bar to depress the table a little bit. So I'm using my body leverage like this just to get in. And I will push down and I will do a little bit of peeling of the glute med and glute min and the posterior hip capsule. Usually George has some good words for me when we're doing this. I'm actually even positioning my leg right in between the table here, so I feel super comfortable. And I can lean more. He knows when I lower the table, he's like, oh, you're getting more leverage, Mike. And I'm like, I am getting more leverage. And this is what I do for the glute med, glute min, as well as the posterior capsule of the hip. So I'm going to walk around the table. I'm going to stay on this side. I'm going to walk around the table. And I'm just going to work the hamstrings a little bit too. So when I work the hamstrings, everybody has a different technique. And this is part of the fascial distortion model. But I'm working the septum. I'm kind of pushing it in an angle 45 degrees this way. Then I do 45 degrees this way. I don't change my hand position, but I change my line of drive when I do this. So I'm pushing towards, this is 12 o'clock, I'm pushing towards 2 o'clock right now. And we work this line this way. Now I'm switching towards about 10 o'clock. So people really love this. It's a great routine for an introductory to the table, the powers of the table and what you can do for the patient. And then I will go to the other side. I'm still on this side of the table, but now I'm going to lower a little bit so I can get some leverage here. And it's the same thing. So we need a lot of WD-40 in this hip joint, as George is laughing, but that's what I'm working on here. You can slowly, and again, if I want to keep my wrist relatively not in the end range position here, so I'm really pushing with a straight, my locked elbow coming from my shoulder and my body. Again, I can always lower it just with a flip of my foot to get better leverage. Then go back to this side too and work the hamstrings. How you doing, George?
Doing good.
Good. Now I'm lucky because George he's a patient that has a high awareness of his body as an athlete, even though he was a desk jockey for a long time, and that's what happened to the hips after the athletic career. But it's a collaboration. It's a team effort for provider and patient to really get a good indication of what tissues are bothering him. So that's the hips. I will now, when I'm going up to the lumbar spine, I'm going to grab the whale's tail here. It's the end here. Just lift it up a little bit. So when I lift this up, we take some pressure off the hamstrings. Now I'm able to assess the low back. So when I assess the low back, I can actually do a little bit of a palpation on S2. I'm checking counter-nutation of the sacrum. I can also check just with a gentle twist. I'm checking the tone of the paraspinals of the lumbar spine. You know, as a chiropractor, I mean, you can also I can just check how it feels with rotation. Whatever your assessment is, it gives you a good indication. Also gives the patient a good indication of what you're looking for, and they will tell you. So now I'm going to start with the flexion distraction for George. And because he has what I call tree trunks, his legs are so heavy. And this is part of the magic of the table. I am going to tilt his torso down just a little bit, so when I'm doing flexion distraction, I'm not working so hard with the weight of his legs. And usually if I'm tilting a patient down, I'm actually going to make sure, I know he's not on blood pressure medication or if he gets dizzy, but I always mention that and ask to make sure that that's a consideration when we tilt down for a little bit of time. So here we go. I'm just gonna, so when I first do this, I will release the table and see how he does. How's that feel, George?
Feeling good.
Okay. So I'm releasing, the tissue's going this way. It's actually I start with the tissue pull already, so now I'm actually working L5, S1. And if you see, if this gets too heavy, if this is heavy for me, then I can raise the table up a little bit, and I can tilt it down a little bit more, and it makes it easy for me to lift this. You'll notice on some patients, I mean, if you have children on here, you actually have to make sure it doesn't come up too fast. But someone like George with his tree trunks, I have to lift a little bit more. And this is, I'm doing L5, L4. I don't know if anybody that's on this webinar went through this process with me at one of the shows, but this is the little dance that I do to really have them get a better understanding of how this feels. George is, you may hear him, you may not hear him, but he's doing a great job of breathe assist with what I'm doing. So I would do that about 2 times. Now I'm going to go over to, I'm going to lock this here because he's heavier, and I'm going to get the QL. And I'll start on this side. And again, I'm going to shorten it a little bit. Not a lot of tension at first. I want to see what it feels like for him. And again, you can see, if you can see my body, I can just lean into it if I have to put a little bit more tension there. And I'm using my thenar and hypothenar of my hand in the palm of my hand to really open up this area. Now you can do both. So I have the flexion extension piece locked. I can do this where I unlock it and I'm able to get a really fluid movement with this area. That's what I was so impressed when I first saw this. I said, wow, I can't believe how it moves so well in all planes of motion. Now, I'll say this is the one area that's more challenging for the doc, but as I'm doing that motion, I'm actually making sure, because I got into this because I have my own back issues and foot issues, like many of us. I'm sure we got into this for this reason, but when I'm doing that, I'm always bracing my torso, so I have a good stabilization as I'm just leaning a little bit forward. But my feet are firmly planted, and it's easier, so I can do this all day. Now I'm going to go to the other side. We'll check the QL on this side. So again, like the first time, the skin is stretched this way, so I can actually kind of sink into this now, and I have a much better purchase on the QL with this. How you doing, George?
Doing good. We
usually laugh a little bit more when we don't have cameras here.
And there's music.
And there's music too. So. He's tighter on this side. And then, like I said, I will do it with a little, I'll release this too. So the table comes with a T-bar that you can put on the foot piece as another leverage point. I'm lucky in the sense that I've got really long arms, so I don't use that much, but I think it's a great addition. So I'm just going where he's tight. He's tighter here on more the flexion. I'll lock that, I'll lock that. Now, I tilted him. So when I tilted him, I'm just going to hit the tilt up button. It's going to stop automatically when it's level. And then if I kept the tilt button, it would go tilt up even further. So now I know that the top piece is level, and I'm still going to have a little, it's not going to be completely level at the bottom. And if it was level, he would honestly feel like a lot of patients feel like they're in hyperextension after that work. So my next area was I'm gonna release the thoracic piece. So when I release the thoracic piece, this is a great assessment tool. George is typically tighter in the upper left, so right when you release it, you're gonna see where they're tighter. He'll be pulling this way. So because he's broader too, I make sure that I have him dangle his hands off the side, okay? Now, for the thoracic spine, I will basically work the erector spinae. I'm going to have tension, and I'm going to peel it this way first. And I'll start this way. And again, George is doing a great job. I'm going to lower it a little bit. He's doing a great job of breathing. Thank goodness. And you can use your body to your advantage with this. I could go a little bit lower. Now I'm changing the angle more to the costovertebral, the angle of the ribs. And even sometimes when I do this, I get cavitations of that area. I'm using the headrest piece as my fulcrum here. You can see that with my other arm, my right hand. I could never do this on another table. Actually, I remember doing this with people seated, and it was a lot of work. I'll go to the other side. Same thing. So as a baseball player, George has had issues with his shoulders, of course, and surgeries. And getting the thoracic spine like this and the CT junction has been really, really helpful. Now I'm changing my angle towards the angle of the ribs. So again, my hand looks like it's in about the same position, but I'm changing the line of drive on it. How you doing?
That was a little tight.
Okay, a little tight on that side. Okay, so before I'm going to lower him down, and then I'm going to do the rotation down the lower back. I do that last before I do decompression of the thoracic spine. I like to unwind this and then get back to the QL region. So this one you put down pretty low, and when I first watched this on the Manuthera website, they made it look really easy. It was hard. But it's about leverage points. So I'm pushing my hand down this way. I'm taking my right leg and pushing the other way with a little pull assist from my hand. So down like this, I have my area that I want to work right here, and then I just rotate George back this way. And he's tight on this side. So again, I'm using all my body weight just to hold this. I've actually even used, sometimes I'll put my knee up a little bit and I can kind of kick if I'm doing a little bit of a side posture adjustment like that. So that's another way to do it. But when I'm doing this, I'm actually going to open it up a little bit into lateral flexion, and you can really even get deeper in this area. A lot of people, George has experienced this a lot, but a lot of people never get this type of work done, and they're amazed at how they feel. Right there. There we go. I'm just going to even off the other side. Again, like I said, this is part of a great dance that I do that really helps the patient. Let me go back to this side. We'll just open them up here. I'm going to lower it. Again, I shorten this position, apply some tension, and then roll them. I can usually do this routine in probably 10 minutes, just so someone gets a good feel for the whole process. But I just wanted to show you I'm doing one more because he's tight. There we go. All right, George, now I'm going to do decompression of the thoracic spine. So with someone like George or someone that's new, I'm going to use both belts just so that he feels confident and comfortable with me inverting the table down. So I'm going to use the bottom one here. Now if George wasn't, if he was thinner, if he didn't have sweatpants that were a little slick, then I would, I could do just one belt. but I want to make him feel confident and comfortable with the whole process. So a little trick I learned too was this. Actually, instead of running over to the other side of the table and trying to figure this out, I just made sure the hole was big enough. I know where this bar is now, and I just do that, so it's already locked in. And then I do the same on this other side. And I rubbed my belt against this, so I just use this as an extra pad. All right, George, you comfortable? You feel nice and secure?
Yes, I am.
Great. Again, you want to check if they have a high blood pressure meds. I have a clock, I have a watch on my hand, but also a clock on the wall. I typically do this for about 2 minutes. George knows the drill. So we're just letting him breathe and relax his arms this way. I'm going to release the thoracic piece. We'll start by the TL, thoracolumbar junction. Just a little motion back and forth. So remember, the facets here in the thoracic spine are 60 degrees, so I'm not really pushing in, I'm really kind of pushing down this way to go in line with those facets. Last time we did this, he felt the sinuses released too from his head on the headrest. Then sometimes I'll get up on my tippy toes and I'll actually just put a little motion into each segment. But this really lengthens. It's a great stress reduction here. So I'm going to tilt him back up. And it's going to, I'm just having my foot's on the pedal all the way until it's going to be flat. Now it's flat. Now I'll lower it a little bit, and then I'm going to take these straps off. But before I lower it completely, remember, if you have a bigger patient, I like to use that bar just to make it more secure. And then this. All right, let me lower this, George. He's a really good sport here. All right, let me lock that. All right. We're going to have you, I'm going to have him turn over. We're going to actually do a little bit of the cervical spine. Hold on. I like to use this because I can feel more. There we go. There you go. So guess what? I don't want to bend down all the time, right? So it's a lot easier to bring George up to me so I can take care of myself. And Michael, I'll show you this. I'm not sure if we can, I want to get with the cervical piece, which is wonderful because there is it's the tractioning component. Now I know George has some fusions here, so what I typically do with the assessment is just paraspinals from CT. And then I can do gentle long axis traction too. I don't know if you'll be able to see that well, Michael, but I'm pushing down, and this is on the Manuthera 242. It's on the Learning Hub, which is great. And the videos are probably 2 to 4 minutes, so you can really see this well. But I'm actually, I will take my forearms and my wrists and push down and then pull with the table so we can get a little bit of distraction. Let's see. just like this. So you can move up or down with each angle. But that, in a nutshell, is the dance, okay? So I'm not sure, like from an assessment perspective, you can use the table, you can do something like motion palp before you have your patient sit down or have them seated, and you use the table to your advantage. I think,
Go back to my corner.
go back, yeah, well hold on, let me lower this again. I'm gonna send George back to the corner here. He's awesome. Oh, a second.
Dr. Mike,
Yes.
Dwayne here. I'm just curious, does the table also tilt in the other direction? We saw how the table tilts up toward the head, but the other direction.
Absolutely. So thank you, Dwayne. I didn't show everything. That was like my quick routine, but it does. I'll show you this here. I'm just going to move this, George, for a sec. I'm going to bend your knees for a sec. So I love this part. Honestly, like if he were prone and you're working on a disc patient, you know, I'm not going to lift this up all the way, but it goes up to, I think, about 65, 68 degrees. So you're going to have, I always do this, Dwayne, and I forget about the bar. But that would be really helpful for somebody that has a hot disc. You can get them on like this, lower it, do your flexion distraction, lateral rotation, transverse rotation, and really open up the lumbar spine. And then they're going to have a really tough time getting up if they had to get off a flat bench. So then I would lift them back up. But this goes up really high. I don't know what high-low tables go up to completely, but this is pretty darn close. Great comment, Dwayne. I appreciate that. Here, hold on. I'm going to put the bar.
So while Dr. Carey is working with George here, we definitely want to open up any questions that folks on the webcast might have. Feel free to type in a question, and we can have Dr. Carey answer any questions that you guys might have.
I'll say this too. I think while they're typing, or Dwayne, if they have questions, the reason why I picked 15 minutes, like for the power routine for 15 minutes, so you can show enough for your patient population to experience something that they probably have never experienced on another table. Maybe F&D, that's about it. But if you're looking at all the other components, to me it's been a game changer, and that's why I think it's been really effective for. I always tell doctors, I said the only limitation of the table is really the imagination of the doc, because people have come in. I said, oh, hold on a second. You need what? And then I'm just like, hold on. It's fun. It's a lot of fun to really figure something out, put your patient in a position where you can lengthen something, relax something, get more leverage on the area that you're looking to if you need to do a mobilization or an adjustment. I mean, even with I use the mulligan straps on the hips for George, and as I'm doing that, I'm tying the strap around my waist, and I'm able to hold him. I can move the table the way I want to move it, and even chiropractors, if you're adjusting with anteriorities, you can tilt the table a little bit to make that a lot easier for you. So there's just endless, I think, opportunities, but it really depends on what you want to do. And like I said, I was trying today. The intention was to show you what we can do with the table. It's a great fluid dance. I don't know if anybody that's on the webinar, like I said, was at one of the shows. So you get a really good idea of what it can do.
Dr. Carey, we do have several questions here. We have somebody with a raised hand. Josie, can you allow that question? Or do I need to do that? There we go. We have Lou. Lou, you have a question? Okay. While we're working on that, there are several questions I have here, Dr. Carey. First question that came in was, how long did it take you to get comfortable with the table?
Okay, well, they call it Knobology 101 with all the yellow knobs, but I will tell you, um, it was really a couple of days, and now it's like the nuances, and that's where I say, like, to me, the learning is always, it's, it's, I got really comfortable, I'd probably say, within a week, you know. That wasn't the challenge, but to me, the learning point and always continuing to learn is even, I got it over 3 years ago, so I'm still coming up with new ways, and I think it's pretty easy. I mean, I make it look really fluid, and when I saw Dr. Hassan the first time, I was like, wow, he really makes that table. It's like a unit. It's one unit for the two of them, the table and the piece, and now people are telling me that too as I work at some of those the trade shows. But I hope I answered your question, because once I actually, one good thing that I learned working the trade shows was I just positioned my feet kind of at a fencer stance, so my top leg is on the elevation depression and the bottom leg is on the tilt. So as I'm working on an individual and I'm like, I need this to be up a little bit, all I do is just move my foot and I push it up. So it's, yeah, and then the other thing too, Dwayne, sometimes I'm using the table to my advantage, so I'll use my body, I'll even put my leg in between here. You know, let me, with George, I put out the traction piece, but sometimes I'm using my leverage this way, here. I'll even come up here if I want rotation as well. So I'm using it's just so well made that I thought of other ways to do it, you know, and that's been the fun part of this, and I'm sure I will keep coming up with them.
Perfect. Next question. What do you do for pregnant women or people with larger abdomens?
Larger abdomens, pregnant women, okay. You can tilt, you can get some cushions to put, like the Webster cushions, or what I'll do, we have the pad for, we're in Southern California, some women have, you know, augmentation of their chest, you know, so you can tilt this part down for the top part, a little bit. I can tilt this part down, but tilt the table up and change the headpiece. So you make accommodations for the table. I mean, the table, you can make it lower up here with the headpiece and this piece coming up. Or, you know, pregnancy, I typically would do more cushions, you know, and even when I'm using people that have a hot disc and they can't go prone, they can't lie face down, I can actually do flexion distraction and decompression with them supine, you know, and you can actually, with a posterior pelvic tilt, I'm utilizing, I'll just get distraction. This way I can get distraction with the traction piece, and I'll use their feet and their legs to do that. That's a great question.
Well, we have another question here, Dr. Carey. I'm 5'1" and having a bigger patient on the table. Will a footstool be helpful and safe? Would you recommend?
Would a footstool? Okay, you could do that. I have a little like a Reebok step that I've used that for my old table, not for this one. But if you're 5'1", this table goes down so low, you're going to get you're going to get a lot of leverage. I didn't realize how low it could go, and I've another person that came to look at the table works with the NBA, and he does a lot, and he's like, to get leverage, he's not as tall as he keeps it really low, and that was a concern, so you can get a lot of leverage with that. I hope that helped.
Perfect. Next question we have here. Can you show how to position shorter patients, 5 foot or less?
Aha. So, it all depends what you're working, okay? So I had a shorter gentleman that I was doing a lot with his calves. I just used this cushion that's for the top piece, and he just was positioned that way, comfortably, and then I laid him out. So, and if they're shorter, I'll make accommodations at the top end, because if I'm working this area right here, if I'm trying to get flexion distraction of the lumbar spine, the LS junction, I want to make sure the belt line is right here. So on occasion, I'm having people slide down or slide up just to accommodate that.
Okay.
Yeah.
Next question. This is from Dan. How often is maintenance required?
I haven't had any maintenance at all. Like I said, the one thing I did, it was my error, is the left side is, most of us are right-handed, so the left side is the driver's side for the most part. And I got my belt on a little part of the cushion, and I wasn't aware of that. So that's the only thing that other than cleaning it, I use this to clean it. It's a citrus germicide deodorant that's really good for this material. So, but I've had it for over 3 years, and it's sounds great. It's quiet. It hasn't needed anything at this point.
Okay, next question.
Yeah.
What's your previous exposure and experience to articulated tables like Cox and Leander?
Uh, Great question. More with Cox when I was in school. I've used the Hill table too, and to me, this is just a lot more fluid. Now I know some of those tables, like there's more of if there's some automation factors. This is pure manual, so I like to feel the tissue tension and work what I need to work. I'm just amazed if you've used or you have one of those tables and you want to figure out the difference. I'd recommend just going to a show or something so you can get your hands on it and to really feel, the weight or the effort you're putting into it, because to me it's been a game changer. Leander, I haven't. I had an old Leander too, and like I said, this is. And there's a bunch of different tables. I mean, I've had some, but like I said, when I saw this, when I went to the show 4 years ago, I wasn't anticipating getting a new table. But then when I saw this, I was like, oh my goodness, I need to. All right, Dwayne, any more questions? I hope that was helpful.
We have questions.
Okay.
Let's see. Next question. There are some questions coming in about the new redesigned Manuthera. So I'm just going to address that right now. Yes, Dr. Carey has the first version Manuthera table. There is a new Manuthera table that comes in a charcoal color. There are a few nuances to this table. It would be best that we probably go over that offline or with one of your sales advisors. But the cushions and the material is different on the new table, I can tell you that. There's a couple of levers and knobs that have changed. So a couple of minor upgrades. Probably the most noticeable upgrade, other than the visual of the charcoal color, which is beautiful, by the way, is the cushions. They are still very firm, but they are softer than the cushion set that Dr. Carey is demonstrating today. And they come in a antimicrobial, I don't want to call it vinyl. It's a very interesting material. You have to kind of see it to understand. So for those of you interested, we do have a shipment of those new tables coming in ETA February. So it's the first shipment. It's as fast as we can get them. We are currently out of this version, but we do have 4 or 5 pre-owned tables in our Saukville warehouse. So if you're interested in a table right away, then we do have a couple of pre-owns. And when I say pre-owned, I'm talking about very, very, very lightly used. Actually, most of them were demos at shows and things of that nature. So let me move on to the next question. Let's see. Uh, uh, what position is better for you to mobilize the CTJ?
The CT junction. Well, I showed you the lateral flexion piece, and the other component is the one I didn't do on George. I would do the same thing I did before with lateral for the thoracic spine, and then you release this piece, and this is the flexion distraction piece. So I will have my position here, my thenar, hyperthenar, put that spinous process right there, and you can do this. Again, it's on that learning hub. You can do this. You can also do this with rotation. And I would do the same trick. I'm not going to ask George to get back up on the table. I know him too well. But you can do the same trick. So when I was doing lumbar F&D, I would tilt his head down because he was heavy, right? Now, if the individual's bigger, you can actually tilt up like this and then use that flexion distraction piece for the CT junction. So you get F&D, you'll get lateral flexion, and some rotation.
Okay, we have Lou back with his question that he typed in.
Yeah.
So how can we avoid any discomfort on the chest area? Some of my clients, especially the heavy ones or big ones, experience the discomfort on the chest area. So I ended up using a pillow on the chest area to protect the ribs.
Yeah.
I don't know
So
if it's more of a comment question.
no, I hear you, Lou, and I've used this too, or I've changed the angle. Sometimes they feel like it's their lower rib cage that they're getting, so you can just tilt up, tilt down a little bit, and move this a little bit. Depends what you're working, Lou. Okay, but that was one initially. I think they were flared out and they could feel that. It's almost like a surfer, when they're hitting, they get calluses there from coming up like that. But you can use the pillow and just open up that space with the table, with the upper piece or the lower piece.
Okay.
I hope.
Question.
Yeah.
Let's see. If you lower the table all the way down, will you still be able to use the flexion and extension function of the table?
Not the flexion distraction piece. You won't be able to go anywhere with that, right? You can use the lateral flexion, but not,
Can you use the rotation?
I'll show you how low it can go. Yeah, you can use the rotation, the transverse plane. You want it really low when you're doing that as well, because you can get better leverage. Like I said, when I'm doing this, I'll show you a trick, because when I got it and was struggling for a little while to say, how do I make sure it's level? And even when I would do this, this is an exaggeration. I'm like, okay, I think it's level. And then the patient's getting up. I'm like, oh man, my table's not level. So I'm kind of using my hands as guides, so I can level it off like this and then do this. But to your point, the question, when you bring it really low, you're going to you can use your body. If you're not as tall as me, you can use your body like this. And this is I think this is the lowest. Let's see. Lowest right here. So there's your transverse rotation. You could do, I've never done this because I'm taller. You could do the traction on the L spine as well.
Okay. Let's see.
And look how low it is. I'm like, that is below my knee.
Yeah.
I forget yeah.
Okay. Can you show the shoulder GHG, joint abduction movement?
Yeah. I'm just going to raise it up a little bit. Michael, let's see if we can get it on this side. Is this side better? Okay. So this piece moves up. to unlock it, right, you saw what I did. I lift it up. This is a locking position here, and it locks at the bottom. So I have to lift it up. And if you're going to do shoulder work, you can do it this way. I don't want to, I would jump in front of the camera, but come on the front side. You can lower this to the angle you want, as well as using this to position the upper arm or arm. So it's really versatile, this one. I hope that helped. And again, all of these, the Lozier, Dwayne, they did a great job with the Learning Hub. And they're probably quicker videos, but I love the questions. I'm happy to help. Like I said, it's been a big game changer for me, because we're always looking, I think the clinicians that are looking for something that really can up their level, number one, as well as get better patient outcomes. This has been a gift for me as well as for the patients. So,
Dr. Michael, Carey, we have one more question from Andrea. She's actually on. She can ask her question to you directly.
Sure.
No, I was just trying to see if I could get it to work. So I've got your same bench. I've had it just over a year.
Yeah.
And my only thing that I really struggle with is using that drop. I just can't seem to get that. I know you said it's not the ideal for if we like using drop, but I just like to use it. I'd just like you to show it again if
Okay.
you don't mind.
Yeah, sure. And I can guess you're not from Boston, right? I'm kidding.
No, I'm in sunny England, where it's
good,
it's a bit rainy and revolting. Yeah.
Hey, well, I'll say this too, because the drop piece, it's shaped like your SI joints, right? And if you go up one level more, it's even the facets of L5 too. So depends if you have a big person on or a lighter person on. You can angle this, right? You can tilt. I mean, you have to lift it up, right? Let's see.
Yeah.
So I lift it up. If I'm going to adjust, and it's just the lift. But sometimes when I first started with this, and it was always going down. It was always going down. I just lifted the table. I actually tilted it the other way, and a little bit lower, and then I could get the drive that way. You know, so I think you'll have to. What was the problem, Andrea? Was it too hard for you to lift, or what was going on?
Yeah, it was a mixture of, but it was doing exactly as you just demonstrated how you first started with it. So I'll be honest, I love all the other parts of my bench. I absolutely love it, and I just haven't practiced it. But I'm just looking at you, thinking I need to just try it again. And I like how you've just put it down a little bit headways, which I haven't tried. So you know, I just need to adjust.
Use the patient's body weight to help you adjust it. Sometimes the patient's body weight is going to be in the wrong position, so you're like, oh, I can't do this. So now you want to basically get the better, play with that, then you're going to be able to see how you can drive it better. Okay? I hope, yeah.
No, cool. That's great. That's really helpful.
Sure.
Okay, that'll be all the questions we'll be able to take. We are at about 2 minutes left. If we could go ahead and have the PowerPoint put up. So for anyone that's looking for more information on the table, many of you in the United States know who Scrip Hessco is. You can contact your representative that you may already know out in the field. But the contact down here, Braden, is a person that can take your email request. He can pass this information on to the appropriate representatives in the field who can set up demos and demonstrations for you guys. You can see his email address at bwoodruff@scripco.com. We will also be sending out a follow-up to this presentation with this information, so you will have it. For those of you that attended this presentation, we are offering a special price. The table normally sells for $14,995 plus tax and freight, of course. For those of you that attended, we are doing the same thing for this presentation that we do at our trade show events. which is a price of $12,500 plus freight and tax. For those orders that come in through by December 15th. Again, the table that you're looking at is no longer available. There is the updated version, which is, for all intents and purposes, very much the same, except with the charcoal gray color on the base and the charcoal gray color on the cushions. Can I ask that we go back a couple of slides? I know we're right at 11 o'clock, but I want to show the table for those that haven't seen it. Josie, is it possible to go back a couple slides where the picture is of the table? That way they can get a visual before we leave the call. All right, let's see. Those of you that are interested in what the new table looks like, it is absolutely beautiful. Again, Lawyer has hit a home run with the way that this table looks. And they will be available. Now, I will say, if you are interested in making the purchase, get your orders in as soon as possible. We have 13 of these tables coming in the first shipment, with orders for another container coming in after that from Finland. So it's first come, first serve, of course. So we've got 13 tables available coming in with delivery in February. This is the look of the new Manuthera table, the charcoal gray base and the matching upholstery. So just wanted to give you guys all a visual of the new look. The old table, I say old table, the previous model has been discontinued. So we do have 4 or 5 of the previous models in our Saukville warehouse for immediate delivery. And again, most of those were used in demonstrations at trade show events or exhibits around the country. They are in great shape. We've had our service people go completely through the table, so they're ready to go. Dr. Carey, we want to thank you very much for taking your time and spending with us. George, we appreciate you as well, being a good sport and jumping on the table. Dr. Carey, I know you've been gracious and you'll be available if anyone has any questions. Maybe they might want to personally reach out to you, so we'll pass on your information as well. But we want to thank everybody for attending. Thank you, Dr. Carey. Thanks,
you.
everyone. Have a safe rest of your week and a fabulous weekend. Take care, everybody.